children to do well. They want their children to be happy, successful, and responsible as they grow from little helpless bundles of joy to hormonal teenagers to emerging adults. But most of all, parents want their children to be healthy. But how much can parents really do to have an effect on their kids' health? And how long does this effect last? The rising rates of obesity recently have called attention to the health risks associated with being overweight. Obese children and adolescents are more at risk to develop cardiovascular disease, diabetes, and bone and joint problems. Several different health interventions have been put in place to boost the amount that kids spend being active in schools, communities, as well as clinics. But parents also have an effect on how kids actually can be active. The Adolescent National Study of Adolescent Health, AdHealth, studies adolescents as they age. Using data from 1995 and 1996, past researchers have explored how parental factors can actually influence their children. So they found that higher parental influence means higher adolescent activity. But they also found that self-esteem and depression that the adolescents had mediated this relationship. This mediation means that despite the relationship that kids have with their parents, psychological factors also play a role and compete with explaining this activity that they have. And so I wanted to know, do the foundations that support healthy behaviors in adolescence carry on into adulthood? Do parents still have this same effect? I looked at these variables in 2001 follow-up data 6 years later, when these adolescents were adults. Using parental factors such as parent-child communication, parental engagement, family cohesion, like how well the family gets along, and parental monitoring, like rules, curfews, and guidelines, I wanted to see if this really mattered. Future interventions with physical activity and obesity can really do something about, rather than telling them, hey, like go outside, go run, or just go outside and play, they can actually work on building a relationship with their kids and focusing on self-esteem and depression and having that impact their kids' health.